Have you been in a car accident and you have a whiplash injury? In this video, you're gonna meet Jess, who we've been just removing all the adhesion around her nerves and the sides of her neck, underneath her skull, the back of her neck, and her upper thoracic spine and her upper back. And she's been getting really nice relief. She's about 50% better so far after 10 treatments or so. It's going great. So I hope you enjoy it.
Yeah, I feel it on my left. It's like a pool right here. I feel like a pool here.
How intense?
Maybe like a 6.
What do you feel here?
I feel a stretch here. Both sides. A little bit more on the left side though.
Here?
Yeah.
Or all of this?
All of that kind of.
How intense is this stretch from 0 to 10?
I'd say that's maybe like a 3 or 4.
And what did you feel at the end range when you had your neck and that made you slouch at the end?
Just some stretching. Kind of like in the middle here.
Both sides?
Yeah.
0 to
A little
10.
bit more on the left again though.
0 to 10.
I'd say like a 4.
So she's having this symptom in here, and the third test, CT flexion, is supposed to be 90 degrees, and she was 79, I believe. So last time I did the spinal accessory nerve, which is a nerve that comes out here, goes down this way over levator scap and goes down the rhomboids here. And I'm still feeling some stuckness right in there. And so I want to see if I can hit 2 birds with 1 stone, freeing up the levator scapula and then also getting more range of motion with this test. Well, previously she didn't have access to tucking her chin in like this. If her head is jutted out this way, levator scap becomes compensatory because the disc is overloaded down here. And then once the disc is overloaded, these muscles under here are protecting and they can shoot headaches up. So we've gotten her now to 21 degrees. She was at 5 and full is 25 degrees. So her range of motion increased from 5 to 21. That's 20% function to like 84% function. And so now her headache should be reduced because she has the ability to keep her skull back because the disc isn't being loaded when she brings her head backwards. Super tight. So that is awesome. I'm pushing on her spinal accessory nerve and her shoulder's going like this. So it's pulled super tight and then her shoulder's trying to protect. So this should cause her shoulder to just sit down and relax. Pulling super tight right from the start. People don't realize that we have muscles on the front of her neck too. So right now I'm moving her throat over to the side. You can see me moving her throat right here. And underneath her throat, you have the carotid artery, which has a pulse, and then inside of that, you have the longest coli muscle, which is right in the front. It's like the psoas of the neck, and it has to stabilize the neck. So if it's entrapped, it will cause overload on all of the neck disc tissue and also the musculature on the backside. And last time she had pretty severe adhesions up here, right underneath her jaw. Just seeing what's sticking out and what's stopping her range of motion from being full. This spot is the worst spot out of all of this area. And now I'm seeing what tissue this is. So this is testing rotatories. This is testing the joint capsule. I feel less pulling there. I feel more pulling there. So we're gonna do rotatories. So we're gonna rotate her all the way to the left and then laterally flex down. Zero to 10 here.
I'd say maybe like a 2.
2 out of 10. What was it before, Casey?
6 out of 10 pull.
6 out of 10. Good. What do you feel here?
That's a lot better, yeah.
You don't feel this?
Yeah.
Really good. If you want to learn more about chronic pain relief and adhesion release methods, hit the like, hit the subscribe, stay tuned every Tuesday and Friday for new videos coming right to you, and I can't wait to connect with you.